Well, life is just a lot more stressful for a lot of us right now, isn't it? And that stress can agitate autoimmune diseases like psoriasis. So during this Awareness Month, we want to bring in Dr. Sherry Ingraham with Advanced Dermatology to talk more about ways to treat it. Dr. Ingraham, I haven't spoken to you in a long time, so it's good to see you. Good morning.
Oh, good to see you, Sally.
Well, let's start first with just what is psoriasis and what does it look like for most people?
For most people, psoriasis is an inflammatory condition that manifests with itchy red plaques. Plaques you can see on the elbows sometimes, on the arms, on the knees. Sometimes we think it appears in those areas because those are high friction areas. Other patients have it throughout their scalp. They have to suffer with scaling throughout their days that can appear on their clothing. And in some individuals, it can occur on their face and their entire body, in fact.
And it can really be emotional for a lot of people because it is misunderstood. Some people may not understand why their skin is like this. What are some of the stories that your patients have told you, and how have they dealt with the emotional impacts?
I think a lot of it has to do with how they feel other people perceive them, because one of the most important things to realize is this is not a contagious disease. This is an autoimmune disease. The only person suffering with the disease is the person who has the disease. So they can't give it to other people, but it really, really can be incapacitating because for work, for example, they can have it on their palms and their feet. It can be very painful. The red areas on their hands and arms at their job can sometimes embarrass them. And so we really think awareness is important, and people realize that this is something that people suffer with, but now we have a lot of targeted therapies that can help patients. So we want patients and doctors to be aware that there are wonderful therapies that can exist to help these patients.
Oh, that's certainly good news. Let's talk about some of those. What are the prevention and treatment recommendations that you give your patients? Is this something that you can use over-the-counter meds or just change your diet to help with?
Diet can have an impact. With most inflammatory skin conditions, getting on an anti-inflammatory diet, avoiding sugars, high-fat foods, and actually weight loss can help psoriasis. Also avoiding smoking, alcohol, and stress. These can all trigger flare-ups. But because it is an inflammatory condition that has a large genetic component, we need stronger targeted therapy. So many patients will start with topical steroids, and really over-the-counter is not enough. Psoriasis needs heartier medications. They need to see a board certified dermatologist. And what's exciting now is we're in the age of biologics. Biologics are injectable drugs that target T cell mediated inflammation in our bodies. So there's these drugs you may hear about: Humira, Imbel, Tremfya, Skyrizi. There's a whole host of these new targeted therapies that can be used in adults, and some are even FDA approved in children. And not only do they impact the skin disease, but also psoriasis affects the joints in about 10 to 30% of patients. It can be very debilitating. So it can help their joint disease as well.
And what about children before we let you go, Dr. Ingraham? Does this look like eczema? Do some parents maybe get it confused and try to sort of misdiagnose their kids, perhaps?
Yeah, it can be a confusing picture. If one of your parents has psoriasis, there's about a 10% chance that their child will have psoriasis. And so oftentimes in children, it can present where it looks like eczema. But unlike eczema, the plaques tend to be a little thicker and again tend to be on the elbows and knees and in the scalp more often. The best thing is to take them to a pediatric dermatologist or a dermatologist for diagnosis, because we have so many more therapies. We do know the most common age of onset for psoriasis is ages 15 to 25. So this is really a spot where people need an intervention. They're really around their peers. They may be self-conscious, but they need to know that the National Psoriasis Foundation exists and they're raising awareness. NPF.org is a wonderful website you can go to learn about treatments and psoriasis and getting help for this condition.
Great. Dr. Ingraham, thanks so much for your time this morning. We hope you have a good rest of the week and stay well.
Thank you. You too.